Today, we're going to discuss 5 myths about PTSD, and myth number 1 is that you can be diagnosed with PTSD within the first week of experiencing trauma. This is actually false. So in the DSM and under the section Trauma and Stressor-Related Disorders, there are 2 main diagnoses that I want you to know about. The first is PTSD, and the second is acute stress disorder. So the diagnosis of acute stress disorder is given when someone has an intense emotional reaction to a catastrophic stressor, and what really sets this apart from PTSD is a timeline of symptoms. In acute stress disorder, symptoms need to pop up within the first 4 weeks of the traumatic event, and they need to last a minimum of 2 days and a maximum of 4 weeks. PTSD, on the other hand, requires that symptoms are present for greater than 1 month. Therefore, if someone has symptoms popping up after the first week of experiencing a trauma, they would actually be diagnosed with an acute stress disorder. Now, if symptoms were to persist for longer than a month, then the diagnosis is switched to PTSD. And an interesting fact is that a good chunk of people who have acute stress disorder end up meeting criteria for PTSD. However, not all people with PTSD have acute stress disorder. For most people, symptoms usually begin within the first 3 months after a trauma, but for others, there might be a delay of months or even years before full criteria for PTSD is met. Myth number 2 is that most people who experience trauma meet criteria for PTSD. So it's been estimated that more than 80% of adults in the United States experience a traumatic event that would qualify for a diagnosis of acute stress disorder or PTSD. However, the lifetime prevalence of PTSD in the US is around 6.8%. So no, the vast majority of people who experience trauma do not meet criteria for PTSD. Now, the type of trauma that someone experiences matters. For example, assaultive traumas carry about a 20% risk for acute stress disorder and PTSD, which is higher than all the other types of traumas out there. Myth number 3 is that resilience building exercises are helpful in preventing PTSD. The research out there that has examined this has been pretty insufficient and limited. And so an interesting study that I came across was published in 2008 in the Journal of the Society of Occupational Medicine. In this, researchers evaluated whether or not giving information about stress and stress reactions to naval and marine personnel who were about to be deployed to the Iraq War helped with improving coping and resilience. So basically, what they did was divide the soldiers into 2 different groups. One received the pre-operational stress briefings, while the other group didn't. And what they found was that there were no significant differences between the 2 groups when it came to factors such as PTSD, alcohol misuse, or other mental health disorders. Myth number 4 is that psychological debriefing after a traumatic event helps prevent PTSD, and this is false. So for those of you who aren't familiar with this concept, psychological debriefing is a single session intervention that's provided to those who have survived a trauma. It's usually given pretty early on after a traumatic event, and it first originated in the military. And there are many different forms of psychological debriefing out there, and some of the common components included within it are discussion of the traumatic event, sharing thoughts and emotions about the event, and education about typical stress reactions and stress management strategies. And study after study has shown that psychological debriefing is not an effective intervention in preventing PTSD. Myth number 5 is that antidepressants can prevent the development of PTSD. And while this thought is nice in theory, it's just simply not true. So both sertraline, which is Zoloft, and paroxetine, which is Paxil, have been approved by the FDA to treat PTSD. And then there are a boatload of psych meds that are prescribed off-label to help further treat the various symptoms of PTSD. However, none of these medications have been consistently clinically proven to prevent the development of PTSD. And this doesn't just apply to antidepressants. It really applies to all medications out there that have been researched. At this point in time, there are no pharmacological interventions that have enough evidence to justify their clinical use in preventing PTSD. However, I want to give you a fun fact real quick. The medication that has shown the most promise so far in preventing PTSD is hydrocortisone. There were 2 studies looking at the use of this medication in critical ill patients and those receiving major surgery. Both of these studies showed lower rates of PTSD symptoms at follow-up. There were then another 2 studies looking at hydrocortisone use in adults exposed to traumatic events who are not critically ill or undergoing surgery. These studies also showed lower rates of PTSD. Out of all the medication options out there, this is the one I'm going to be looking most closely at, and I'm interested to see if future studies will replicate these findings. Now, if you found value in this video, don't forget to hit that subscribe button. And if you want to learn more about PTSD, make sure to click that top video.